Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
Raspy voices, sneezing and coughing, just a few of the sounds we're hearing as the winter season ushers in a host of viruses. Keeping your kids home from school, maybe. Well, here with expert advice on keeping your kids healthy, Dr. Sue Hubbard, award-winning pediatrician and medical editor of KidsDoctor.com, and Dr. Dawn Johnson, Associate Medical Director at Children's Health Pediatric Group. Welcome. So nice to have you with us.
Good morning.
Okay, Dr. Sue, first of all, you and I were talking about this before. What's the time of year for the flu, and has there been much activity yet?
So flu season is typically runs from November into spring. Often by now we're seeing flu, but actually we're not seeing much flu in Texas nor across the country. But it's coming, Jane, okay? So don't be lazy about getting your flu vaccine.
Okay, you were saying that a lot of kids have been sick, just had colds and stuff like that. How do you know if your child has symptoms of the flu specifically?
So flu is usually you're a little sicker. You feel worse. So you have a fever, you have a sore throat, you have a headache, you have lots of myalgia, muscle aches, and then you have this terrible cough. Flu puts you in bed. A cold just makes you feel badly. Occasionally, young children with the flu will vomit, but vomiting and GI symptoms are not typically flu symptoms.
Okay. Dr. Johnson, I've noticed a lot of people coughing. When should you worry about a child's cough?
That's a great question. Most coughs will resolve on their own and don't require any intervention at all. Things that are worrisome in children, if they're breathing hard and fast, if you see their ribs when they're breathing in and out, if they complain of chest pain or shortness of breath or chest tightness, if the cough persists longer than 7 to 10 days and isn't getting better, coughs can last several weeks but normally get better after 5 to 7 days. You might need to give your doctor's office a call.
Okay, now if I'm a mom or dad sitting out there, what's the best way to treat a cough?
A tincture of thyme. Most coughs get better on their own. Other things that have been shown to help are honey, especially a teaspoon of honey at night. If your child is older than 12 months of age, younger than that, honey isn't safe. Hydration, make sure they're drinking plenty of fluids, and humidification. So using a humidifier or steaming up a shower in the bathroom and putting your child in the bathroom helps.
Dr. Sue, you mentioned RSV before we came on. Exactly what is RSV and how is it treated? It's not like horrible.
RSV is a virus we see every year. It's also seasonal. It stands for respiratory syncytial virus, and it causes colds in all age groups. Okay. Unfortunately, in younger children, often babies or children who have underlying diseases, heart disease and things like that, they have more serious complications with breathing. So it is RSV season right now, but really fortunately, Dr. Johnson and I were talking, it hasn't been a bad RSV season. Plenty of kids are sick, but they've not been really critically ill this year.
Dr. Johnson, a lot of parents go, oh gosh, I don't want to call the pediatrician again. But how do you know, I mean, at this time of year, when to call and when to just wait it out?
Again, like Dr. Hubbard said, if you have a child with an underlying lung disease or heart disease, you want to call sooner rather than later. If the child is, again, shortness of breath, chest pain, breathing hard and fast, looks ill, weak, lethargic, persistent high fever, then give your pediatrician's office a call. Or if you're worried, when in doubt, give the office a call. That peace of mind is priceless.
Dr. Sue, finally, best way to keep germs from spreading?
Hand washing and run, don't walk, and get your flu vaccine.
All right, just had to throw that in there.
It's a good match this year, they're saying, so it's a good time to get it.
All right, thank you both for being here. Appreciate it.
Thank you.
Hoping we all don't get sick. Visit childrens.com for more information on keeping your family healthy. You can also follow Children's Health and the Kids Doctor on Twitter and on Facebook.
Just like you're always by your child's side, we're Children's Health, and we're by your side. Visit any of our 40 locations for exceptional pediatric care.